I was 19 years old when I contracted bacterial meningitis. I would describe myself as a pretty active, normal college student. Went to school most of the time. I was pretty active socially and played a lot of sports. Probably about 24 hours before I got really sick, I felt like I had a sinus infection. Looking back at it was an illness that I really had never felt like before. I was vomiting profusely, and the thing that really set it apart for me looking back was the feeling of almost like vertigo or just spinning in my head. I am totally blind in my right eye and have 2300 vision in my left eye, neither of which is correctable, which makes me legally blind. From the time I entered the hospital in the ER to the time I left in a wheelchair, my room was a revolving door of doctors, nurses, and therapists. I can remember being extremely frustrated that I was learning very basic human skills like swallowing, smiling, sitting up in bed. Luckily for me, I have a wonderful family who are very supportive, as well as a large group of friends who were very supportive during the hospital stay and through my recovery, even through today. My faith and my family were the two most important things for me during my hospital stay.
John and I met through a blind date, and John was very funny, easy to talk to. He's handsome, so that helps.
I think I still am funny.
You are.
Moving forward from meningitis, life is significantly different than it was before, but I've been able to do some miraculous things in my life, like meeting Erin, and even having children was something that I really didn't feel like was going to be possible.
John is a wonderful husband and an even better father. He's just the most optimistic person that I know.
I felt like it was a time to get involved in meningitis advocacy because I hadn't heard of meningitis until I got it. After finding the NMA's website, I pretty quickly connected with several other survivors and were able to discuss our stories and share them together.
It's the Ambiguously Blind podcast with your host, a guy that's great at hearing, but terrible at listening, John Grimes.
I started a podcast called Ambiguously Blind, which is a good place for me to articulate my life, my lifestyle, and how my life is different after bacterial meningitis. It's a great way to interact with other people and help spread the message of awareness and education about bacterial meningitis. I strongly encourage parents to make sure their adolescents receive the first dose of the MenACWY vaccine between the ages of 11 and 12, and the second dose at age 16. I also want to encourage parents to talk to their teen's doctor about the MenB vaccine at age 16.